My name is Goldie Keira. I'm a consultant in trauma and emergency surgery. I work at Brighton and Sussex University Hospital here in Brighton. So I look after patients who come in, any sort of injury, emergency or trauma. There's a big team with me, so we have lots of junior doctors, nurses, physiotherapists, lots of different types of specialties, A&E doctors who look after you when you come into hospital. And basically what I wanted to talk to you about today is about minimising your risk when you are unfortunate enough to have a cycling injury.
So I'm a keen cyclist myself, so there's lots of health benefits to cycling. It's free, it's cheap, you've just got to maintain your bike, you don't have to worry about parking. So it's a really enjoyable sport. All of my family cycle. Really my main worry is that if you're not a regular professional cyclist and you're doing it intermittently, you are not going to be wearing a helmet usually, and I think that's a major worry. You can have absolutely life-changing injuries from a simple fall off a cycle. Doesn't even have to involve another car. You can be swerving out of the way of a pedestrian, a tourist, a young child, a dog, anything, and I've seen all of the above come to see me in A&E and then require admission and long stay. An injury to your brain in particular, even with a normal scan, with no bones broken, can require you to be in hospital for a long time as you recover and have rehabilitation. So wearing a cycle helmet, I'd rather it was the foam and the actual structure of the helmet which was injured, or you see helmets in all sorts of disrepair and cracked and in total pieces. I'd rather it was that than your skull. So that can bleed internally, and also on the outside your scalp can bleed a lot. So we're just trying to avoid those things.
It can be a bit controversial, and it's not not necessary legally for you to wear a helmet, but I think we should change the culture that it should be cool to wear a helmet rather than thought of as an inconvenience. So if you can do that and just reduce the risk and minimise the risk of injury that you're having after a head injury, you're going to spend less time in hospital if you're fortunate enough to have an injury, and get back to cycling, get back to what you enjoy.